Hi everyone, Amber Canoy here with Everyday Kentucky. We're over at UK Healthcare and Dr. Bernard is with us. Tell us a little bit about your role here.
Thanks, Amber. I'm the Trauma Medical Director, so I'm the lead physician for the Trauma Center. And this is a level 1 trauma center, so this is the highest level available in terms of trauma care. And we serve a population of about 1 million people, central and eastern and southern Kentucky.
Given the fact that it's the only level 1 trauma center in the area, what does that mean for you all in regards to how much blood you really need?
Yeah, we use a lot of blood. Now, the truth is the majority of patients who are injured and come in don't need any. But those who do need blood probably wouldn't survive without it.
Wow.
So for those who have bleeding, and that's a lot of the patients we see, it's really life-saving.
So let's take that scenario, those people who mean like it's absolute life-saving and they need it really bad and urgently. About how much are they needing?
We see about 5,000 to 6,000 patients a year here. So coming from a population of about 1 million, about a 100-mile radius, get transferred in, often by air. They land on the roof here or they drive up to the outside. Once or twice a day, at least, we will have patients who require blood transfusion within minutes or hours of arrival, for whom if they didn't get it, they probably wouldn't survive. And that population really is everybody from the community. That's the thing about injury. Injury affects everybody, so everybody could potentially need a blood transfusion. We've had transfusions from folks as young as 3 weeks old, just in the last year,
wow,
all the way up to 95 years old after injury. So really it's everybody. Could be anybody, any of your viewers.
How much are they using typically?
Average patient who's really severely injured will receive about 10 units. That's a lot. That requires 10 folks who've gone out to the blood center and made a donation. We've given, just in the last year, up to 152. We had one woman receive 105 units just in the last year, and she survived.
Wow.
So she wouldn't have survived without those 105 people who made that donation. I like to think about it like everybody who's going out to the blood center and donating is part of our trauma team. It's a really big team, and all the donors are part of it.
Yeah, and we're having the WKYT blood drive September 11th and 12th, so obviously we want to encourage everyone to donate there. Why is it so important to have a wide variety of blood types available?
The one people talk about a lot is O, because it's the universal donor. And those are really, really valuable, because when people come in, they often can't tell us their blood type. We don't know, so we give O because it's safe for everybody. But those other blood types are equally important, because as soon as we know they're
right,
A or B, we can use some of our A or B and preserve the O for people who are unidentified. And importantly, it is relevant to folks like yourself who are women of childbearing age. We need particularly that O negative. So that's really the most valuable one. But we need them all.
Yeah.
You're right on.
All right, so what would you tell somebody if they're just a little bit still on the fence about donating?
Yeah, you know, the folks out at the blood center are experts. They're like Peyton Manning. This is all they do all day, is they do these blood donations, and they're really, really good. So don't worry about that. It's minor. In the course of everything we hassle with through a day, donating blood, easy, and it should make you feel like you really are giving a gift of life. It's that special.
All right, go donate today.